from Hyderabad, Dr. Ravi Kiran. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. Ravi Kiran is a leading gastro in Hyderabad, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows his to deliver patient-centric care. Sir, we salute your dedication to spreading awareness related to liver health. So now I invite Dr. Ravi Kiran to enlighten us on topic NASH knockout tips for healthy liver. Sir, over to you.
Yeah. Hello, everyone. Thank you, Dharmendra, for the kind introduction. Okay, I'm Dr. Ravi Kiran, gastroenterologist working at Continental Hospitals, Hyderabad. I like to thank for Zydus for giving me this opportunity for presenting about NASH. This is the recent hot topic for everyone. Everyone have their concern about this liver. So I hope I'll be helpful for you all today. Yeah, first of all. So as we see, this is this in this current era, we keep hearing a lot about fatty livers, and everyone is terrified because of the dreaded complication that is the liver disease, which happens if it is not managed properly. So now, for managing any condition, first we need to see what is the thing which is causing this fatty liver and treat the cause so that we can eliminate this fatty liver. Something wrong with the presentation. Anyways, something wrong with the presentation. Yeah. So the first a brief introduction about the liver. The liver, as you know, it's the largest solid organ in the body. So it is located in the right upper hand portion, that is the upper abdomen on the right side. Okay. Normally it's a soft brownish colored structure, which when damaged will become very hard and cirrhotic liver. So, what are the functions of the liver? So, what does the liver do in our body? The liver plays a very vital role in the body. It has multiple functions, including and not limited to the digestion in the form of bile. It secretes bile, and also it helps in protection by generating the immuno antibodies. And then it also helps in detoxification. That is, whatever we eat, everything goes through the liver and then only goes to the blood. So whether it be it medications, food, or anything, so all the toxins we just day in and day out, those are all filtered by the liver. And it is also a storage organ. That is, it stores all the excess nutrients. Whatever we take, everything from the intestine goes to the liver. It gets stored in the liver, and then when needed, it gives back to the other organs, what as per its requirement. And it also produces cholesterol, that is, which is everyone think it is a bad thing, but cholesterol is also very important. It helps in the cellular integrity, it helps in the cellular homeostasis, maintaining the balance. Okay. And it also helps in detox, as I said, it also helps in detoxifying the alcohol which we take on a daily basis. So now what is NAFLD, or now recently which terminology has been changed as MAFLD, that is metabolic dysfunction associated fatty liver disease. So what is this? So as the name itself states, it is a disease where there is excessive accumulation of fat. So by definition, whenever the fat comprises more than 5% in the liver, then it is called as fatty liver. So when this goes uncontrolled and fat keeps accumulating in the liver, then it progresses into NASH, or now called as MASH, that is steatohepatitis. Now the inflammation starts happening. Now the damage starts happening. If this progresses, then it will lead on to the end stage liver disease. So what is the prevalence now? So almost it is estimated that almost 30 to 40% of the human population all over the world is suffering from this disease called as NASH. So why? Why? And of late, this incidence has been increasing a lot. Why? Because of the diet and the lifestyle patterns which we are following. So as we see, each year almost 25% have NAFLD regardless of the weight, irrespective of the weight. And male gender also has been postulated to be a risk factor for NASH. Now, so this slide actually gives us a better picture of what happens in fatty liver disease. So in the initial first stage, what we see, the first image, the pinkish, brownish, good, smooth-looking liver, that's the healthy liver. Next, as we know, all these oils are yellow in color. So when excessive fat deposition, all then it balloons up or swells up, causing this fatty liver that we can see in the second image. Now, slowly, when this fat accumulates, next the damage happens, and whenever there's damage in the body, they're always healed by scarring. So, in the liver disease also the same thing happens. Whenever there is inflammation and small amount of damage in the liver, then it heals by scarring, causing fibrosis. This fibrosis, if the damage is extensive, the entire liver gets scarred and turns like a stone. That's called cirrhosis. The cirrhosis Greek word meaning stone. So the end stage of this liver damage leads to cirrhosis. So next, what is the difference between NAFL, that is non-alcoholic fatty liver, or non-alcoholic steatohepatitis? That is, and now the terminology has been changed. So what is non-alcoholic fatty liver? So it is just plain fatty liver, just accumulation of the fat. The difference is the NASH is there is inflammation, that is active damage is going on in the liver. This damage ultimately leads to scarring known as fibrosis. So coming to causes. So as I told you, fatty liver disease is any disease which causes damage to the liver causes fatty liver. So among which many causes are there. Most common things are nowadays it's the NAFLD, that is metabolic syndrome associated fatty liver. The other causes include hepatitis B, hepatitis C, alcohol, and other genetic diseases as well. So now our talk is restricted to mainly this metabolic syndrome associated fatty liver disease. Now, what are the causes of this metabolic syndrome? MASH, M-A-S-H. So one of the common causes is overweight or obesity. And then the genetic factors also play a important role, especially in Asian population. And next would be our own doing. This is food intake. Whenever our health diet habits are not good, if we take regularly food intake and high caloric food intake, high fat food intake, high sucrose food intake, all these things cause NAFLD. And in combination is physical inactivity that causes excessive accumulation of fat in the liver. And even some medications also can cause, especially some cancer medications, some hormonal pills, all these also can cause fatty liver disease. The another important thing which the prevalence is increasing is metabolic syndrome. So what is metabolic syndrome? Metabolic syndrome is a condition where we have diabetes, hypertension, and overweight. That is waist circumference more than 110 in males and 95 in females. So this is a syndrome which is increasing in prevalence, and this is causing multiple diseases in humans, including liver disease and cardiovascular disease, that is heart problems. So obesity and fatty liver disease. So being overweight also causes multiple problems in the body, including liver and heart problems, and also metabolic syndrome, metabolic dysfunctions like diabetes and hypertension. So whenever there is excessive fat, always we try to store things. That's a human tendency. So even our body does the same. Whenever there is excess of nutrition, so what does it do? It tries to store somewhere. So liver is one of the organ where which has the capacity to store things, and that's it's a curse also for that. So whenever there is excessive nutrition in our body, the all the sugars, everything gets converted and gets stored in the fat, in the form of fat in the liver. So this has been multiple studies which have shown that diabetes and fatty liver disease has been interconnected. So diabetes itself can lead to MASH, that's fatty liver disease, and in the vice versa. Even fatty liver disease also has been shown to have increased onset of diabetes. So now coming to the symptoms. So what are the symptoms of fatty liver disease? Basically, in the early stages, there will be no symptoms apart from little digestion issues and tiredness and vague discomfort or pain, especially in the upper abdomen on the right side where the liver is located. So as the symptoms progress, then other symptoms starts as the disease progresses, then other symptoms start setting in, like swelling of the feet, swelling of the tummy, itching, and yellowish discoloration of eyes, yellowish discoloration of the urine, and excessive daytime sleepiness, and uh, sometimes vomiting of blood, etc. So next important would be the diagnosis. So how do we diagnose this condition? So many of times, as I already told you, it is asymptomatic in the early stages. That's why it can be a silent killer, as because without investigations, it is difficult to diagnose fatty liver disease. Till if you wait for the symptoms, it will be very late. So what are the tests? How do we diagnose? So it's a basically combination of clinical examination, then symptoms, blood tests, and the scans. So what are the blood tests? The most common blood test which we see is the liver function test, in which we see a particular parameter called as liver enzymes, that is SGPT and SGOT. So whenever this fatty liver disease is seen, we see elevations in this particular enzyme called as SGOT, the transaminases which we call. And these can be still be normal very early disease, and then slowly they start increasing. If still persistent and we will not treat it, then it can even lead to progressive illness. And still one more catchy point is that majority of the patients, LFTs, that is this transaminase, SGPT and SGOT, still can be normal in spite of being a fatty liver disease. So strictly speaking, we can only diagnose through other tests which I'll be talking about. So coming to the non-invasive tests, there are some groups of parameters called as FIB4, which you can, when you consult your doctor, they can calculate these scores based on which we can place you on which stage you are on the fatty liver disease. So coming to non-invasive diagnosis, as I told you, first is the blood test. Next would be the imaging studies. That is one of the imaging studies is the ultrasound. So ultrasound, which everyone you are aware, it's a very simple, non-invasive, painless test which anyone can undergo anywhere. There are a lot of ultrasound scan centers. So it's also very economical. But there's a catch here. So the sensitivity of ultrasound is that it can detect fatty liver only above 20%. So if it is less than 20%, still you are in spite of you having a fatty liver disease, there is a chance that you might miss. So now, and one more thing is what does we cannot differentiate between the fat and fibrosis. Fibrosis, as I've told you, it's a damaged, little advanced state of fatty liver disease. So that cannot be distinguished with normal ultrasound. So the next would be, so how to diagnose this fibrosis? There's a test called as fibroscan, which is based on the principle of sound. So here we detect the stiffness of the liver. So the more the stiffness of the liver, higher is the speed of the sound. So with that, we can get absolute value by which we can tell there is some amount of damage, some amount of fibrosis which is going on, and so it's time to act now. And again, it's a non-invasive test. It is available freely, and it differentiates fibrosis and fat. But the main disadvantage would be when there is excessive subcutaneous fat, then that is obese patients, then there can be some amount of misrepresentation. So that's when we see this transient elastography, where we see two parameters called as liver stiffness measurement and CAP. So there are more advanced, more higher imaging like MRI scan where we see the proton density fat fraction. Again, this is not available, and again it's a costly, and but it's a highly sensitive and gold standard. But the ultimate diagnosis of fatty liver disease is through a liver biopsy. So liver biopsy, it's an invasive test, so and it has its own risk. So we have to check for certain parameters before going ahead with this biopsy test. And it causes some pain and some risks also are involved during this procedure. So only if there's absolute indication, we go for this liver biopsy. The advantage being we can even diagnose other conditions apart from fatty liver MAFLD. And the good thing about this is it is a very slow illness and it's a lifestyle related disease. So it will take years before it becomes very late. So you always have a good amount of time before you can intervene. So as we can see from the flowchart, there's an isolated fatty liver, then with inflammation, then NASH, and ultimately the end stage that is the NASH cirrhosis, which can lead to formation of even malignant liver cancer. So it's always better that we take preventive measures early, start your modifications early before the late stage starts in and before you lose your chance to reverse it. Coming to so what to do now. So there are multi-pronged approaches there, starting from diet, lifestyle modifications, exercise, and if still progression is there, then we can start on your medications, which can be given advice can be given after consultation with your doctor. So, what are the things? The first and foremost is the weight. The more you weigh, the more obese you are, there's always a risk of rapid progression of this liver. So, losing as good as even as less as even 3 to 5% of the body weight can reverse fat accumulation in the liver. And those who are in the stage of fibrosis, at least 10% of weight loss, that too slowly can go. Even the next 1 year, you can reduce this amount of body weight. It gives a lot of improvement in your fatty liver disease stage. So as I've already mentioned, so weight loss of almost more than 10% even improves fibrosis to an extent of 50% of fibrosis. So this is the main backbone, is the main important step, first step which everyone should take before embarking on other measures to reduce the fatty liver disease. Next, again, the diet. So the diet modifications, what things we have to avoid is high fat foods and high glycemic index food and saturated fats. These are things we should avoid. Even the simple carbonated beverages or even juices, fruit juice, which everyone considers is very healthy, those can also on the long run can cause fatty liver disease. So instead, go for fruits rather than fruit juice because fruits has fiber. Fiber is good. So when this fiber is there, it regulates your blood glucose absorption, the dietary fructose and glucose absorption, thereby helping in preventing fat accumulation in the system. And other diets which you have to avoid is red meat, alcohol, and things which you have to increase is high fiber, vegetables, lot of vegetables and fruits, not juices, fruits again. And some things which in moderation you can take is eggs, cheese, yogurt, and which you can take on a daily basis, nuts, legumes, seeds, herbs, and spices. And avoid white things. All this white maida, white sugars, everything these are all very bad for your liver. So take as whole wheat bread or whole grains rather than making it into flour. Next would be the physical activity, the types of exercises which you want to do. All these aerobics exercises, they reduce the liver fat, maintains a good weight, it improves your cardiovascular conditioning, and helps in reducing weight. While the resistance exercises improve the liver inflammation and also improves the way the sugar is utilized in the body by improving the insulin sensitivity. It also improves the metabolic parameters. Next would be a lifestyle tips. So our body needs all of these. So regular checkups, including and eating small and frequent meals, timely food intake. So do not delay your intake and lowering your sugars intake and getting enough sleep. That's also very important. Irregular sleep and food patterns have been associated with increased stress in the body that also translates into liver fat and fatty liver. And also when you do something, it should be a regular pattern. When we say daily physical activity, it should be a daily physical activity, at least a 30 minute a week, 30 minutes a day for 5 days a week. That also helps in reduction of liver fat and fibrosis. And ultimately, if these all things fail, then we go for the medications. There are so many medications which have been there in the market, which include initially which have come as vitamin D, vitamin E, then pioglitazone, saroglitazar, which is called Vilipsa, and at least recently also many studies have been published with this, showing at least 1 year treatment of this saroglitazar has been shown to improve liver, improve NASH with or without fibrosis in both diabetic as well as non-diabetic patients. While those non-diabetic patients, vitamin E is can be preferred. While those with diabetes and dyslipidemia, then saroglitazar can be preferred. So ultimately, what are the tips to prevent fatty liver disease? So limit the intake of saturated fats, eat a good diet, have a good sleep, maintain a healthy weight, then exercise regularly, quit smoking, alcohol, and avoid unnecessary medications. Especially everyone keeps going and taking antibiotics or painkillers, all those things on the counter, over the counter. But those are things which we need to avoid because all these things, whichever we take to our mouth, goes to the liver. So there are so many medications which are hepatotoxic. So these can cause liver, fatty liver, and liver damage. So on this event of Fatty Liver Day, I would ask everyone to have a regular health checkups, prevent overweight, avoid overweight, improve your physical activity, have a look at your diet, and maintain a healthy liver so as to prevent this global pandemic. Now, the next pandemic is called this NASH cirrhosis. Thank you.
Thank you, sir, for this wonderful talk.
Yeah.
This has enlightened us.
Yeah.
Now we will take the questions from our audience with your permission.
Yeah, sure.
So there is a one question is asked by audience is that when we have to consult the specialist for this fatty liver disease.
Yeah, that's a very good question. Because at least when we are suspicion, if any symptoms of fatty liver disease, which I have mentioned, like any pain, discomfort in your upper tummy, always consult a gastroenterologist after doing all these liver checkups with the basic test called as liver function test, get an ultrasound done, and based on the risk stratification, we'll be advising if any other further investigations are required, or any diet or lifestyle modifications are required, or any medications are required. So look for symptoms, and if any risk factors for liver disease, like family members suffering from any liver disease, or if you're having alcohol intake and any other medications intake, then it's always better to consult a doctor. Or at least above the age of 35, yearly once at least have a checkup with a doctor. Yes.
Okay, there is a one question is also asked that is this NASH is age specific?
No, this NASH is also seen in pediatric patients. That is, even in children, we see this NASH. It is not age specific, although there is correlation between age as well as the metabolic dysfunctions related, overweight. All this have been proposed as risk factor, but still, even in thin patients also we can see this fatty liver disease. Even in children's pediatric age groups also we see this fatty liver disease. Again, I have told you there are some genetic mutations which can cause this fatty liver disease. So it is not restricted to adults only. It can be seen even in children.
Okay, sir. So I think our audience have got the answer with this informative talk. So,
Okay.
sir, on behalf of Nest 24 by 7, I thank you for this lively and informative talk.
Thank you.
As you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by fatty liver to regularly visit doctors and continue medication.
Yes.
With careful observation and precaution, it is possible to obtain the control of the disease.
Yes.
I would also thank to our audience for their active participation and patience to making this event successful. So stay connected with Next 24/7 on Facebook and take care of yourself and your family member. So, sir, thank you very much. Have a good day, sir.
Yeah, thank you.